Hello, this lesson is about ear infection or acute otitis media, which is prepared for non-healthy care professionals. An ear infection, sometimes called acute otitis media, is an infection of the middle ear, the air-filled space behind the eardrum that contains the tiny vibrating bones of the ear. Children are more likely than adults to get ear infection. The symptoms of ear infection, the onset of signs and symptoms of ear infection is usually rapid. Signs and symptoms which are common in children include ear pain, especially when lying down, tugging or pulling at an ear, trouble sleeping, crying more than usual, fussiness, trouble hearing or responding to sounds, loss of balance, fever, drainage of fluid from the ear, headache, and sometimes loss of appetite can occur. When we see the causes of ear infection, an ear infection is caused by a bacteria or virus in the middle ear. This infection often results from another illness, such as cold, flu, or allergy that causes congestion and the swelling of the nasal passage, throat, and the eustachian tubes. To understand this well, we should have to talk about the role of eustachian tubes. The eustachian tubes are a pair of narrow tubes that run from each middle ear to high in the back of the throat behind the nasal passage. The throat end of the tubes open and close to regulate air pressure in the middle ear, to refresh air in the ear, and also to drain normal secretion from the middle ear. Swollen eustachian tubes can become blocked, causing fluids to build up in the middle ear. This fluid can become infected and cause the symptoms of an ear infection. In children, the eustachian tubes are narrower and more horizontal than adults, which makes them more difficult to drain and more likely to get clogged. That is why children are more frequently predisposed to have ear infection. When we see risk factors for ear infection, those includes age. As I have said, children are at high risk for having ear infection, especially children between the age of 6 months and 2 years are more susceptible to ear infection because of the size and the shape of their eustachian tubes and because their immune system are still developing. The other is group child care. Children cared for in group setting are more likely to get colds and ear infections than children who stay home. The children group setting are exposed to more ear infection, such as common cold. Infant feeding is another risk factor. Babies who drink from bottle, especially while laying down, tend to have more ear infections than do babies who are breastfed. The other is seasonal factors. Ear infections are most common during the fall and the winter. People with seasonal allergies might have a greater risk of ear infections than others when pollen counts are high. Poor air quality is another risk factor. Exposure to tobacco smoke or high levels of air pollution can increase the risk of ear infection. The other is cleft palate and the cleft lip. Difference in the bone structure and the muscles in the children who have cleft palates might make it more difficult for eustachian tube to drain. When we see the complications of ear infection, most ear infections don't cause long-term complications. Ear infections that happen again and again can lead to serious complications such as impaired hearing, speech or developmental delay. If hearing is temporarily or permanently impaired in infants and toddlers, they might experience delay in speech, social and developmental skill. So a baby should have to learn or should have to hear before they start to speak. The other is spread of infection to adjacent structures such as mastocytes and meningitis. And tearing of the eardrum is another complication. Most eardrum tears heal within 72 hours, but sometimes it might need surgical repair. Regarding prevention, the following tips might reduce the risk of developing ear infections. Those are prevent common colds and other illness. Teach your children to wash their hands frequently and to not to share eating and drinking utensils. Teach your children to cough and sneeze into their elbows as you see on the picture. The other is avoid second-hand smoke. Make sure that no one smokes in your home. Away from home, stay in smoke-free environments. The other is breastfeed your baby. If possible, breastfeed your baby for at least 6 months and continue up to 2 years. Breast milk contains antibodies that may offer protection from ear infection. The other is using a cup instead of bottle to feed babies. If you bottle feed, hold your baby in upright position. Avoid propping a bottle in your baby's mouth while he or she is laying down. Don't put bottles in the crib with your baby. The other is vaccination. Vaccination is very important to prevent ear infection. This is all about ear infection that is prepared for non-surgical professionals. Thank you for watching and for subscribing to this channel.